every person is unique, and therefore their treatments and the side effects they experience are also unique. For example, I had chest radiation because the tumors were around my heart and my lungs. This meant that the lining around my heart was impacted by the radiation, and by the end of treatments, it was a little swollen and I experienced some chest pain. At first, I was a little scared, but after talking to my healthcare team, they reassured me that the swelling would eventually go down and the pain would go away, and it did. In this video, we're going to hear more from Jerry and Charlotte about the side effects they experienced and how they communicated that with their healthcare team. We'll also hear from some other professionals about what can be done to manage the common symptoms that people experience while receiving radiation treatments.
Radiation treatment side effects really depend on what part of the body you're treating, how much dose you're treating the patient to. Pretty much everybody gets some level of tiredness. And most people, because the radiation has to go through the skin, could get some level of skin irritation. The best way to know for you as an individual patient is for you to ask your oncologist and get that specific tailored answer for you.
I was very fortunate with the radiation and the chemo. Like, the only side effect I remember having during it was difficult to swallow. I was tired. That was another thing. But I overcame it, you know.
So my burn and irritation wasn't as extreme as I've seen it. So I was fairly fortunate that way. I mean, I still had some, like, I did have to wear something on my head, especially if I was going outside. Cold, I became very sensitive to cold. I'd get chills quite a bit, especially when I was extra fatigued. Food, what I could eat was definitely, everything's tasting different, especially with radiation being so close to my mouth and everything and my taste buds.
Some people will feel very ill, some people will not feel ill at all. Some people find that this is the easiest part of their treatments through cancer. And it doesn't matter how you feel, how sick you feel, or how well you feel throughout the treatment is still working the way it's supposed to be. If anything feels off, anything feels uncertain, something you have a question about, a reaction that you're having that you're not sure if it's related to your treatment or not, please ask your healthcare providers. It's really important that we help you through your treatment.
Radiation ultimately will damage all cells, but you will see the effects with the cells that are dividing faster sooner than you will see it with the cells that divide slower. And so, for example, you have cells in the lining of your mouth or the cells that grow your hair. Those are rapidly dividing cells. So if somebody is irradiating the mouth or the scalp, you would expect that pretty quickly after the radiation, if you've given enough dose, you're going to see the effect in terms of hair loss or some temporary mouth sores. So radiation treatment side effects can happen either within the few days as you're starting on your radiation treatment. Some of them will develop after several weeks of radiation treatment. Usually once the radiation treatment is stopped, those side effects will peak in the next week or 2 weeks, and then gradually your body will catch up with the healing and those side effects will settle down.
So the two primary side effects that patients may notice are fatigue and skin reactions. Skin reactions occur simply because skin is the first barrier that radiation will go through. Their skin may become dry and itchy over time. Worst case scenario, the patient's skin becomes red and sore, and sometimes it can get a little bit, sometimes little blisters as well. One of the best ways to avoid skin reactions is to simply be gentle with your skin. So when you're at home in the shower, avoid really hot water. You can use a mild soap when you're in the shower. When you get out and you're toweling off, make sure you pat dry the area that we're worried about. Do not scrub it. In terms of using creams and lotions during treatment, make sure you ask your healthcare team what they advise. If you are having side effects, please notify the radiation therapy staff, as we can direct you to the resources that you may need.
Fatigue was a huge trouble for me, but the best way I found to fight that or to help that was more than anything trying to stay active as much as I could. Sometimes I just even walk to the gym, do a few stretches and walk back to my hostel, always with one of my family members. Sometimes I'd be able to get a bit of a workout in, obviously a modified workout compared to, what I did before and do now. But those were good days. And then bad days, I would try and at least get out of bed, do some reading. I kind of just got really committed to my diet. So I made, and that took a good part of the time, is just when researching, finding recipes, making sure that I was getting as much bang for my buck when it came to nutritional value.
I see patients, I talk to patients about what types of concerns they have. So whether that's appetite, nausea, taste changes, difficulty swallowing, or weight loss is one of the huge ones. During treatment is really not the time to lose weight. The reason for that is that when you lose weight unintentionally in a treatment type setting, you're losing a high percentage of muscle mass. That's gonna put you at a lot greater risks. And so the more that we can prevent that weight loss, the better chance we have at having better treatment outcomes and better quality of life. A lot of people really struggle with taste and smell changes. So that's one of the hugest factors in their appetite. And what you can do is, if smell is really bothering you, try your foods cold. Like if at supper time you don't feel like roast beef, then try cold cereal and see if that is more manageable. Or try a liquid beverage. A lot of times for people, it's actually easier to get liquids in than solids, and it doesn't make you feel quite as full. So one of the neat things that you can actually try is to have a smoothie, a milkshake, or one of those nutrition supplements instead of having a meal or a snack if you're really struggling with your appetite. Now, just keep in mind that smoothie or the milkshake might not have enough calories and enough protein to completely replace the meal, but work with your dietitian to see if you can get enough protein and calories in. So if you're having any questions about diets or your health related to your nutrition, please ask your healthcare team to see a dietitian.
The number one side effect that patients present with is fatigue. It varies in severity throughout treatment and post-treatment. The fatigue can be related to the amount of activity that the patient is involved in day to day. So I definitely encourage maintaining a level of activity, doing a 20 to 30 minute walk a day, 5 days a week, even doing just a few minutes of walking after each meal, something that will help keep them as active as possible. Also taking into account that radiation does increase your tiredness level and you might need more rest, and to recognize that it's okay to take rest, but it's also important to maintain a level of activity.
Jerry and Charlotte both experienced side effects from their radiation treatments, but with the help of their healthcare team, they were managed effectively. You may experience some side effects like fatigue or skin reactions, but also you might not. Some people won't have any side effects, while others may notice quite a few. It all depends on the area of the body that's being treated. Side effects can occur during or after treatments, and that's why it's so important for you to communicate with your healthcare team and ask them questions. It's not necessary to suffer through side effects without any support, so make sure you ask for help. With the support of your friends, family, and healthcare team, it's possible for you to live well with, through, and beyond radiation treatments. I'll see you soon.